From the Cronkite studios in downtown Phoenix, this is Cronkite News.
Good evening and welcome to the special edition of Cronkite News on Arizona PBS. I'm Quentin Walker. Thank you for joining us. Tonight, we take a look at the top health stories here in Arizona, from an increase in fentanyl overdoses to how an app can help people dealing with diabetes.
A new report from the CDC shows that even though fentanyl deaths are down on the East Coast, overdose deaths in the West have actually increased. Ellie spoke with the DEA to find out why.
Fentanyl is a synthetic opioid. Its most common medical use is to help patients manage pain. But fentanyl is a potent opioid, more than 80 times stronger than morphine, leading to abuse of the drug. The DEA says illegal fentanyl is often mixed with heroin to boost potency, but that also makes fentanyl deadly. Nationwide, it was found in nearly 40% of drug overdose deaths in 2017. Fentanyl now ranks first for fatal overdoses, nearly twice the rate of heroin deaths and 3 times the rate of deaths involving methamphetamine.
Very cheap drug, highly addictive, very deadly.
Fentanyl, a synthetic opioid the Drug Enforcement Administration says is at least 10 times stronger than morphine.
When you take an opioid like fentanyl, heroin, even the pharmaceutical pills, you just fall asleep and you don't wake up.
A report released today by the Center for Disease Control with 2017 numbers says fentanyl was a factor in nearly 40% of drug overdose deaths. Curry says that in Arizona, fentanyl can be as cheap as $5 to $7 per pill.
Just fiscal year 2019 alone, Arizona law enforcement seized 1.4 million of the M30 pills, which resemble oxycodone.
Holly Hedegaard, the lead author of the study and a medical epidemiologist for the National Center for Health Statistics, says that although the new report shows the northeastern states of the country being severely affected by fentanyl overdoses, experts worry the expansion of fentanyl into western states will mean a new chapter in the opioid epidemic.
In 2011 for fentanyl was 0.5 per 100,000, and in 2017 the rate is now up to 8.7 per 100,000. So it's increased rather dramatically.
These drugs are just deadly. There's nothing to them that's of any benefit.
The DEA hopes that informing people about the dangers of fentanyl can reduce the number of overdose deaths.
Paying rent can be a challenge for many Arizona families, but the challenge of juggling bills disproportionately affects Hispanic ones. Cronkite News' Tyann Marshburn took a look at how rising housing costs are affecting their ability to pay for health care.
Yannette Rubio is a single mother of 3.
It's difficult for someone like me. We don't have resources.
Rubio says that she makes $1,500 a month and pays $1,200 for rent. That leaves her with only $300 for groceries and nothing for medical care. Last year, she said that she had an emergency but couldn't get the help that she needed.
I was in an accident and my knee is hurting me. I couldn't go to the doctor because I don't have money to pay for the doctor.
According to a study presented by Chicanos por la Casa and Unidos US, in 2017, nearly 30% of Hispanics living in Phoenix paid more than 50% of their income on rent. That doesn't leave much money for anything else.
The people we're seeing are really struggling.
Edney Gonzalez, co-executive director for Helping Families in Need, says that they educate families with financial hardships on their options for assistance.
Our organization helps families apply for Access, SNAP, TANF, and Kids Care, also the Affordable Care Act, the ACA Marketplace applications.
In the Valley, Chicanos por la Casa promotes the idea of home buying versus renting.
Budgeting, credit, those things that are necessary in order for them to become home buyers, they can use those same skills to rent properties if they aren't able to purchase at the time.
Rubio says that she's been renting for the last 2 years but is looking to find another place with lower rent. In the meantime, she says she has no other option but to be patient while she looks to improve her living situation.
You have to tolerate many things.
In Phoenix, Tyann Marshburn, Cronkite News.
According to a study conducted by the Arizona Department of Health Services, between 2013 and 2017, 20% of Hispanics in Arizona didn't have health insurance.
Studies have long shown the struggles Native Americans have accessing appropriate health care, especially in urban areas. Cronkite News reporter Ricky Cornish is here to tell us about a new grant that will bring more treatments to more people in Phoenix. Ricky?
Yeah, Jenny, I got in touch with Native American Connections, a nonprofit that helps around 10,000 individuals and families each year. For almost 5 decades, the organization has provided behavioral and mental health care to Native Americans in Phoenix. Now, a new grant will allow the group to offer more services to help those in need. The Indian Health Service awarded $200,000 to Native American Connections so that the group can offer some basic medical treatments.
This grant money will allow us to be able to hire a family nurse practitioner and bring on board a medical case manager, which is something we've never had before.
More than half of all American Indians live in metropolitan areas, including 90,000 in the Phoenix metro region. Native American Connections operates 18 sites across central Phoenix to accommodate clients.
Our history has been to be a behavioral health organization, and this is a grant to integrate primary care medical services.
Thank you. Residential treatment centers like this one, Patina Wellness Center, will offer new services including immunizations, wellness checks, and even forms of therapy.
This is more about expanding access, easy, simple access. So when people are receiving other services with us, they can receive their medical care at the same time.
We'll be doing some additional outreach in the community to really target the Native population and be able to provide some integrated services to those people.
If you or someone you know is looking for health resources, you can call Native American Connections at 602-424-2060. Native American Connection services are open to everyone. In the Broadcast Center, Ricky Cornish, Cronkite News.
New information tonight. According to an annual report conducted by the Arizona Department of Health Services, sexually transmitted diseases are on the rise in Arizona. But what is causing the increase? And what are the most common STDs people are contracting? And where can they get help? Ryan Mushkat has the story.
1 year ago, Francisco Garcia says he lived a nightmare.
A simple task to me going to the bathroom was impossible.
Impossible and painful, and he wasn't alone. According to an annual report conducted by the Arizona Department of Health Services, over 54,000 STD cases were confirmed in 2017. Between 2016 and 2017, Arizona increased 16% in STD cases. Chlamydia is the most commonly reported STD with nearly 40,000 cases in Arizona in 2017. Gonorrhea increased 94% in the last 5 years. Brenda Thomas, the CEO of the Arizona Family Health Partnership, explains what's at the root of the problem.
I think a lot of it has to do with education. Our youth have not been educated about what an STD or an STI is. They might not know what causes it. If they do know what causes it, it's sex, and so that sometimes that is also stigmatized.
Counselor Yvette Alvarez of Wesley Health and Community Center agrees.
There are several factors regarding why somebody wouldn't want to get help with an STD, particularly around the idea of shame, but they oftentimes see a doctor like they do a parent, and so that authority figure keeps people from actually reaching out and getting the resources they need.
With sexually transmitted diseases and infections on the rise, there are people out there who want to help you and who want to stop the stigma that is associated with them. But you can also do your homework and get protected.
And we provide reproductive health care, STD, STI screening and testing, access to birth control, and cancer screenings.
And as for Garcia, he says he learned a valuable lesson.
You know, my best advice would be always seek medical attention. It's the best thing that's going to be for you. You're going to be able to go ahead and get the correct and professional treatment in order to fight any type of STD and just help you normalize your life back together, you know, so you can be able to enjoy the best things.
In Phoenix, Ryan Mushkat, Cronkite News.
A new report tonight shows an alarming number of cases of West Nile virus in Arizona. So what's causing the increase and what are authorities doing to prevent it? Tyann Marshburn has the details.
This year's monsoon season was not very active, but cases of the West Nile virus, which is spread by mosquitoes, are high.
I was throwing up and I was so dizzy I couldn't see, couldn't walk.
Kimberly Colson discusses the symptoms of West Nile virus. She says she was diagnosed last year.
The pain, the memory, a lot of people, I still have problems with swallowing.
According to the latest report from the CDC, Arizona has the most cases of West Nile virus in the nation. The Arizona Department of Health Services reported 140 cases and 11 deaths. 137 cases were in Maricopa alone. Dr. Rebecca Sunenshine of the Maricopa Department of Public Health says that there is no treatment for the West Nile virus.
If somebody is having a headache, a stiff neck, or any type of neurological symptoms, of course they want to go see a doctor.
According to Johnny DeLaunay, Public Information Officer for Maricopa County Environmental Services, the county is working on reducing the number of cases in the valley.
We go one day, set up the trap, we leave that trap overnight, and then the next morning we go and collect those traps. We bring them back to the lab.
In addition to setting mosquito traps to test the insects for West Nile virus, DeLaunay says that they also use other methods to fight the problem.
If the traps are meeting our protocol for fogging, then we'll go back and spray that 1 square mile area where that trap is located.
According to health authorities, mosquitoes can grow in as little as a water bottle top or in a pond of water.
They want to pick up those pet bowls and planters, empty out the water, and even scrape the inside edges so the eggs can't hatch.
Colson is learning more and more about the virus every day, but is still constantly worried about mosquitoes.
Where to? I must have PTSD to mosquitoes.
In Phoenix, Tyann Marshburn, Cronkite News.
Every 2 minutes, a woman is diagnosed with breast cancer in the U.S., with 10 to 15% of those cases being hereditary.
Cronkite News reporter Ashley Stewart spoke with medical officials about genetic testing and how vital it is.
Increased awareness and more accessible testing are all factors of prevention. Genetic testing plays a large role in early detection of breast cancer.
In families where there's a very extensive history of cancer, many generations, and many with the same type of cancer, that should set off an alarm bell in that family.
Donald Northfelt, an oncologist at the Mayo Clinic, says BRCA genes 1 and 2 are responsible for the majority of genetic predispositions to breast cancer.
People are born with BRCA mutations, and so any tissue in their body can be tested looking for that mutation. Any cell in the body should carry that mutation if the patient has BRCA mutation.
According to the National Breast Cancer Foundation, approximately 45% of women with BRCA gene 2 mutation will have breast cancer by age 70. Madison Lafleur, a genetics counselor with Honor Health, says regardless of a positive or negative test result, there must be a process that is followed.
We're going to have to change your screening if you have a family history, or it's going to have implications for your family members because we might still want to test other people that could be at risk for a genetic mutation, even though you tested negative.
Genetic testing is recommended if a person or their family has a history of cancer, or there is a known inherited mutation.
How will this testing affect family members, and what can we do to hopefully put them at ease? And if they get a positive result, how can we work with them to get them through the initial shock and make sure that they're getting the correct screening that they need?
Dr. Northfelt says the best way to approach genetic testing is to work through your doctor and your medical insurance. Live in the newsroom, I'm Ashley Stewart, Cronkite News.
Almost 11% of adults living in Arizona have diabetes, or close to 600,000 adults. Diet, exercising, and insulin can help patients, but keeping track of all those things isn't always easy. But now there's an app for that, as Ricky Cornish reports.
The Mayo Clinic and Arizona State University recently teamed up on a research project that can help people with diabetes live a healthier lifestyle. Dr. Bithika Thompson and Maria Adela Grando partnered up to develop an innovative way for doctors to help patients manage their diabetes.
As a physician, it's very frustrating when I see a patient in clinic and they can't tell me what they ate for breakfast yesterday, let alone, remember 2 weeks ago.
Every patient is unique.
No patient is managing their diabetes in the same way. So we wanted an app that gives us the data that we needed to take action.
The new app called iDecide allows patients to record what they're eating and drinking as well as their daily exercise routines. Doctors can then access that data and prescribe appropriate treatments.
Creating an app where a patient in real time can tell me all that information and I can make much more meaningful decisions on how to improve their care.
You can also take a photo of your food and upload it to the app to let your doctor know how you're doing.
We can actually see pictures of what the patients are eating. We can get a glimpse into what kind of exercise they're doing. I mean, things that we wouldn't understand necessarily otherwise.
With more information at their fingertips, physicians can create customized plans to fit the person's needs.
Patient and clinician can talk about it during the duration of the encounter. They can discuss about it and they can personalize the education and the interventions.
Doctors and patients are currently testing out the app, but once it's complete, iDecide is expected to be free and widely available for everyone. In the control room, Ricky Cornish, Cronkite News.
A new initiative seeks to improve the quality of life for employees of Arizona companies. Its name in Spanish is Por Tu Salud, and it's already available and free. Ryan Mushcat spoke to representatives of an organization that's using the app with their employees.
Por Tu Salud is a Spanish version of the Wellness A to Z initiative, which is part of the Greater Phoenix Chamber Foundation. It is designed to offer free, accessible wellness resources to employers in Arizona. Felipe Ruiz from Equality Health says his organization is using the benefits provided by this program.
It's a benefit not just for us, but also for the family. To be healthy, it's a full circle to be more active. To make a small change now is making a big change in the future.
Por Tu Salud is specifically focused on improving the quality of life of the Spanish-speaking community. Its purpose is to attract employees, retain them, improve their productivity, and lower absences. The program promotes good eating habits, exercise, and a healthy life-work balance. Tomas Leon at Equality Health says this initiative is a great tool, not just for his employees, but also to promote healthy habits among underserved communities. He says his organization is developing Spanish language material to inform the Hispanic community about healthy habits.
And we focus on subpopulations that have experienced greater disparities in care and health. And so we're bringing a new culture of care to the community here in Arizona.
According to Kim Samuel, Senior Vice President of Equality Health, the organization has over 100 employees participating in the program, which is very beneficial for them.
As a company, we also try to serve the diversity of our workforce as well, which we feel like the Wellness A to Z helps us address that.
Por Tu Salud has partnered with companies in the Valley, such as Cancer Treatment Centers of America, Delta Dental of Arizona, and more.
Por Tu Salud offers free solutions for businesses in Arizona. It complements existing programs and offers tools to improve them.
New efforts are underway right now to help children who suffer from anxiety and depression.
Cronkite News reporter Ashley Stewart spoke with a school psychologist and other experts looking for innovative solutions.
Stress over school, making friends, and social media. These are just some of the worries causing a rise in anxiety and depression in kids under 18. Many still aren't getting treatment, but here in Arizona, some experts are working to fix that.
How are we going to teach our kids to kind of be more self-aware and manage their own emotions and problem solve? And that's, I think, across the country becoming a bigger ordeal.
School psychologist Ashley Cronebetter wants to give her students more tools to help them cope.
We have an intervention team, and so for any of those kiddos that need that extra support, whether that's small group or just checking in one-on-one, we track it that way and monitor, like, are they using their tools? You know, is it being successful? Are they, maybe having to leave class less?
More than 8% of kids ages 6 to 17 have been diagnosed with anxiety or depression, but there is still a need for more resources. Ryan Stoll is the co-creator of Compass for Courage, a program designed to prevent chronic anxiety in children.
Can we take what is known to be some of the best available evidence-based tools for child anxiety, package it into a game-based program, and deliver it through community settings like schools?
The program uses board games, role-playing, and other methods to teach kids to overcome emotional obstacles.
You know, our Face It game, for example, we have all these situations here that are, really commonly anxiety-provoking within the schools, and we help them, identify some that are like a 3 or 4 on what we call our yikes thermometer.
Diana Diaz Harrison is a mother of an autistic son who struggles with anxiety. She knows knowing your child's triggers and working with their school can help minimize disruptive behavior.
Your child might need a certain type of accommodation or structure, and to not be ashamed, because everybody has needs and it's just okay to ask.
Stoll wants kids and their parents to know it's okay to worry, but help is out there.
You can do something about it. You have the power to reduce that anxiety so you can, thrive in anything that you do.
Compass is in 50 schools in Arizona and has plans to expand across the nation. Live in the broadcast center, Ashley Stewart, Cronkite News.
Clinics in Arizona receive thousands of dollars for their dental programs, with one clinic getting $300,000 to expand their services.
Tyon Marshburn tells us how they will use the money to improve care for underserved communities.
Maricela Cornejo brings her kids to the dental clinic at Mountain Park Health Center twice a year.
At this age, they get lots of cavities because they don't brush their teeth or they eat too much candy. As a mother, I worry.
The center is one of 6 clinics in Arizona to receive a grant from the U.S. Department of Health and Human Services. They will get a total of $300,000 to improve their dental program.
This was a grant where the money is earmarked for replacing infrastructure and updating infrastructure, and that's exactly what our clinic needed.
Liliana Garcia, the dental department chair for Mountain Park Health Center, says that the grant is vital to improve services to communities in need.
I feel that because we work at a community health center, that people have a certain mindset about it, and that perhaps they think we're not going to be delivering the same quality of care with the same type of materials and equipment, and this really allows us to say, hey, no, it doesn't matter who we're treating, we're going to use the top-notch technology and equipment that we can.
Not only will they be updating current equipment, but also extending the dental program to the Tempe and Goodyear location. According to a report released by Datos, last year only 38% of Hispanics visited a dentist in Phoenix, which leaves 62% without oral health care. According to Cornejo, the problem is the high cost of services in other clinics.
Mostly the 2 older kids. They have a discount, then I pay about $25 or $30 per visit.
Cornejo is happy with the care that they receive at Mountain Park Health Center and says that they would return again. In Phoenix, Tyon Marshburn, Cronkite News.
Can an ancient massage technique help address health problems, including fertility?
Apparently, Arvigo can. It's a form of mind massage that originated in Belize.
Cronkite News reporter Gabrielle Oliveira explains why some women have turned to this holistic approach in hopes of conceiving.
I had the opportunity to speak to 2 women who used Arvigo therapy along with their practitioners. There are only a few practitioners in the state of Arizona. The women say that this type of massage has made all the difference for them.
It was always a dream for Sarah Fleischman to have a child of her own.
Well, my pregnancy journey is incredibly long and was incredibly expensive.
It wasn't easy. Fleischman struggles with fertility and tried for years to conceive. Then one day, Fleischman asked her friend, Lorraine Paquette, about something called Arvigo therapy, which Paquette practices.
I have a background as an occupational therapist and a hand therapist. And as a hand therapist, I was very comfortable with working on decreasing adhesions in order to improve the function of the parts like tendons and nerves and so forth. And so after finishing massage school, I heard about Rosita Arvigo's work and felt like this made sense to me.
Arvigo is a massage that targets the abdominal area. The idea is to reposition organs to release blockages. It's named for Rosita Arvigo, who learned the technique in Belize and brought it back to the U.S.
I believe in all of the energy work and all of that, so it helped
to me, I wasn't worried about it. If nothing else, I got to be more grounded and I got a massage. So
These women believe that Arvigo therapy has helped them achieve their dreams of starting a family. According to Melinda Leon, Sitzman's practitioner, the massage helps align the body.
It's non-invasive. There's different techniques that, it doesn't have to be so in-depth as you think it is.
There is currently no scientific data that supports the claim that Arvigo therapy is directly correlated to pregnancy. Massage has been shown to reduce stress, however, and stress can affect a woman's ability to conceive.
And I'm very thankful, especially because right now she's taking a nice nap. But I still sometimes am in disbelief that it's real and that I finally have a very wonderful little kiddo who's very healthy.
A bone marrow donor from Connecticut had the chance to meet the cancer patient from Arizona whose life she helped save. The meeting was organized by the nonprofit Gift of Life, which focuses on fighting blood cancers.
Gift of Life is an organization that cures blood cancer through marrow and stem cell donation.
I joined through a college drive. A friend of a friend felt really moved by it and decided to do a college drive.
There are thousands of people each year looking for that one person who is a match with them who can save their lives.
When they discovered it in me, I was at 94% of my blood cells were basically contaminated. So I was really at the final deadline.
When I got the call that I was a match, it just kind of was like a no-brainer for me.
We had kind of just figured it was going to be a really long process at that point. She was really eager to be involved with the process. So breath of fresh air at that point and just a sigh of relief.
I'm excited. I'm excited. I think that's my one-word answer. I'm ready to make a new friend.
Really excited. Somebody who saved my life, so I'm beyond words right now. I wouldn't be here if it wasn't for her, so thank you's not enough, but it's really all I can think of.
And if you're inspired to see if your bone marrow could be a lifesaver for someone in need, go to giftoflife.org.
That's it for this special edition of Cronkite News. Thank you for joining us. For top Arizona stories anytime, go to cronkitenews.azpbs.org.